Welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. Today we're talking all about what is high definition liposuction. You've seen a lot about this in social media. You've seen a lot of people talking about high definition liposuction, especially plastic surgeons. And I think the timing was just right. A few of us, including myself, gained a little weight during the pandemic. Afterwards, it made this transition to this fit and fabulous life. Some of that had to do with the weight loss revolution. Some of that had to do with GLP medications. And as people started to feel absolutely great, started to work on making some transformations on themselves, they also wanted their body to look as good as they feel. And the timing's perfect is what I'm saying, because there was the ultrasound, some of the liposuction techniques, some of the new energy devices have all come to the market at the same time. And the cool thing about that is it's really let us do what we call high definition liposuction, which is more than just removing fat, just cutting skin. It's truly following the body's natural anatomical architecture to create something supernatural but super fit. So we're going to dive into it. But when you're thinking about high definition lipo, the take home here is this: you're really trying to follow the natural anatomical architecture just to enhance your natural anatomy. And there's different levels at which we can do that. So we'll dive into that a little bit as well. When you look here, today we're going to talk about the ultrasound, how that can help us do this. What other procedures we can do with some of this, because you'll see some other things that we do that really enhance this, kind of all come together, if you will. And then some post-op pearls. When we talk about high definition liposuction, one, not everybody's a candidate for it. No question we can do some high definition built into your tummy tuck to help you as well. Sometimes we need to incorporate some energy devices to be able to get that skin tight and right so that you look fabulous, because if you have loose skin, it's not going to show off that hard work. Also can just make it look like bad lipo, so we got to be really cautious about that. We also want to make sure that when we're talking about high definition liposuction, there's a wide spectrum that we could do. And this is where it's super important to talk to your plastic surgeon. Make sure that you guys are on the same page about this. Anyone listening, I definitely recommend bringing in some pictures. Helps us be in a good location with that, because there's a full spectrum of high definition: soft, medium, high, ultra definition in terms of things. So we can play with that to get you to a great spot, but we really need to know where we're both trying to get to in terms of our goals so that we can guide you and play with that. Because when we talk about soft definition, it's typically just the little subtle vertical lines, and then we can start putting in some more of these inscriptions, pulleys, to get us to a great spot with all of that. So just some stuff to think about as you're going. We definitely don't want to make it look too artificial, and that's where blurring and doing these soft transitions, I think, is absolutely priceless. A couple other things to think about. The ultrasound has been a huge leap forward in terms of plastic surgery, no question, but also with liposuction. If you think about it, in the past, liposuction was just cannula being stuck in. We just did it by feel, and that was it. Now we can use the ultrasound to check our depth. We can use the ultrasound to make sure how much fat we're taking, but we also can use it to guide us on our muscular anatomy. That way we make sure we're truly following your anatomical architecture, and this way everybody's a little bit different. It doesn't look too fake, doesn't look too artificial. It's you just shining through. You're welcome. Other things to think about when we're doing this, and you can see an image here if you're watching us on YouTube, which I highly encourage. You can actually see we've marked out our high definition, and then we can use the ultrasound to actually follow that. A lot of times we'll mark people in the pre-op holding. When you come to surgery, I'll actually use the ultrasound to confirm that, tweak anything we need, measure the depths in which, so I get a good idea of how much fat I want to remove in every area to make sure that I'm getting this as smooth, making sure the transitions are just perfect. Another check, both at the beginning, during, and end, to try and make everything as perfect as possible. Look, surgery's hard. The body heals in different ways, so we need to do everything we can to get you into a great spot. Might as well use the tools that we have. That way we can maximize your results. When we talk about HD lipo, this is a great, subtle, sexy. You can see the vertical lines coming down, because when we talk about soft definition, we're following these natural lines along the edge, and that's what gives us that kind of vertical stretch. Any of us that, like myself, they're maybe a little heavy back in the day, vertical lines make us look slimmer. The V coming in shows off those hip bones, gives you that super sexy look, but can be subtle, right? They don't know whether you're living that plastic surgery life or that HD lipo life. And that's where this subtle sexy, I think, is absolutely phenomenal. This is probably the most common request that we get, because it's just that subtle sexy where you see those vertical lines coming in, look super slim, gives you that nice V look. One of my absolute favorites, because I think it's something that really resonates with most people. I myself, maybe a little ultra definition. We'll get into that. I want to show off my 8-pack abs, but that's not for everybody. I probably don't have 8-pack abs either. This is just another example if you're watching us. But I'll talk you through it. When we do the liposuction here, the goal is really just creating all the normal architecture. You can see the hip bones coming in. We make those lateral edges of the rectus muscles, your ab muscles, And then when people talk about 4, 6-pack, 8-pack, whatever it is, it's how many of those inscriptions, which is actually the pulley of your rectus muscle. We're following that out. And so when we're doing high definition, we can do this for the entire abdomen. And most commonly when people talk about high definition, the abdomen is what people think about most commonly, but that's not the only one. You can do high definition for anywhere you really have muscular anatomy. We can do it for the arms, we can do it for the back. For a lot of men, we even do it for the pec muscle and chest, because that is something that's great. I'll tell you, especially for our male patients, shoulders isn't a hidden gem because that gives us that nice V back, gives us that wider shoulders, and then comes down into the chiseled chest all the way down to the V-shaped waist. Hidden gem, if you're listening, high definition is definitely more than just abs. I think that's something to keep in mind. When we talk about bringing this ultrasound high definition together, the idea is you're using the ultrasound, you're measuring the depth, you're marking that anatomy, getting to a great spot. Then we do our liposculpting. Then we can check our definition with the ultrasound again just to make sure everything's perfect, because when you're thinking about high definition liposuction, it's the evolution of liposculpting, right? From just liposuction, which is just removing fat, to the liposculpting, we're actually sculpting, shaping. And this is where we're taking your natural anatomical architecture, enhancing it, getting you to the spot that you want to be. There's definitely a spectrum that we can do. And again, we can control that with your help. A couple other things when we think about this, and we're talking about high definition lipo, a lot of our patients get multiple treatments. So no question, high definition lipo to create the sexy abdomen, create a nice, subtle, sexy shape. She had a little bit more musculature to her. We're using the ultrasound for, again, a little bit more definition, because we can actually do what's called a RAF procedure, but we're injecting fat into the rectus muscle. We can do it here because it's safe. In the butt, we don't do that, but we can actually inject it into that fascia, pop those little spaces out, get a great feel for it, but then it's trapped in those little inscriptions, so you're highlighting that shape, so that way it's going to follow them no matter what their shape changes. I'll show you a little bit more of that, but super cool. Renuvion J Plasma, skin tightening, super important, because we talked about it earlier. If that skin's loose, the skin's not right, you're not going to look tight and right. And because then it's not going to show off that anatomical architecture. So this is where I think it's important to make sure that you're addressing all the things, not only the shape, but the skin laxity, making sure that it all comes together, something super important to think about. And then with the targeted fat transfer of the butt and hips, will obviously change shape. The other thing, and we'll talk about in one of our other episodes, we actually already have if you've missed it, but Rib X, because if your goal is shape, there's only a couple ways to do it, right? Bringing in the waist, enhancing the butt and hips. People now no longer necessarily want this massive butt and hips, but if you can change that shape, bring that waist down, shape those abdomens. If you're a male, even doing some deltoids, other things like that, you can definitely change that shape pretty dramatically. Even if it's only a little bit at each part, it makes a big change when you do the summation of all those parts. The subtraction of waist, subtraction of the fat, the addition of the fat to the hips, butt, maybe the subtraction of the ribs equals that summation of a super snatched waist. Couple things, other things that we think about when we're doing this, when we talk about this next level of definition or ultra definition, this is where we can use the ultrasound and some fat transfer into that superficial rectus muscle. So you can see a great image here. We can see that rectus muscle, we see it, we feel it, and now it's trapped in that spot. So regardless of your weight change, it's in the spot that we put it. Unlike just superficial where you're etching or you're just carving out different layers of fat from underneath the skin, here you're actually sculpting that entire rectus, the entire abdominal area to get into a great spot with everything. That's one of the reasons that I love this. I think it brings it all together really nicely. When we do some of these pearls, of a couple things is making sure that we're getting into a spot where we're following you. I think making sure that we're actually on the same page of how much definition you want, because there's a lot of options to look super sexy. Everybody's got a different mind of what they want and what's super perfect for them. This is a great example if you're watching, because the cool thing here is that you can see how well these muscles look. So everything is filled really nicely, but still looks super natural because it follows her natural anatomical architecture. And I think that's what's absolutely key. I think that's huge to make sure that we're getting them something that they absolutely love. Video I love to share with all of you guys. Couple last things, I've talked about it a few times. If you're not thinking about skin laxity, you're not tightening the skin, it's gonna be hard to get a breathtaking result unless you've already got naturally tight skin. So if you're on the weight loss revolution, doing a little GLP medications, definitely make sure you're talking to your plastic surgeon about whether your skin is gonna retract, whether that it needs a little help along the way. Renuvion, absolutely fabulous option for some of that. Here's just another one. Someone who actually lost a weight, got to a great spot, and then did some of the tightening here. I think that's been super, super helpful in terms of things. That way we get you into the spot that you want, super sculpted, just a little subtle definition, looks absolutely fabulous in terms of things. Super excited to share all of this with you guys. On another episode, we'll get into some more of the post-op care, a little skin coaching on another day. But remember, high definition liposuction is just liposuction that's sculpting you, following your natural anatomy, and getting you something absolutely fabulous. There's a wide spectrum. Remember, high definition doesn't just refer to the rectus or to the abdominal muscles. You can do it for all sorts of body part. Also, there's that spectrum of it, so make sure you talk to your plastic surgeon. You want a little soft, subtle, sexy definition, all the way to ultra definition. Plastic Surgery Untold, greatest podcast in the world, is voted by us. Super excited to share this with you guys. We'll see you guys soon. Listen to us anywhere where you get your favorite podcast, iHeart, Pandora, Spotify, or watch us on YouTube. See you soon. Bye.